So hello and welcome everybody to this webinar on LymphaTouch for burns management. My name is Dominic Smith and I'm the clinical application specialist at PhysiQuip. I'm really excited for this session this evening and really pleased to announce and welcome Janine Evans, Rachel Wiltshire, Donna King and Mira Presentation to the call, who are all going to share their expertise around LymphaTouch for the management of burns. Before we start, just so you know the format of the session this evening, we've got around about 20 to 30 minutes of presentations from Mira, Janine and Rachel, which will then be followed by an interactive question and answer session where you can pose your questions to our speakers here and get them answered. Don't forget, this session is being recorded, so you can get access to this after the session has finished. We'll send you that out in an email following the session. For any questions that you do have, you can use the question and answer function, which is at the bottom of your screen. Select that, type your question in there, and we will endeavour to get them answered for you. For those of you who are new to PhysiQuip, we are a UK-based medtech distribution company who partner with LymphaTouch. What we do, one of our aims is to work with people from around the world to bring some of the most innovative technologies to the UK markets. We specialise in soft tissue management, and burns is something that we've recently started to work into with the LymphaTouch. With that covered, I'm going to hand over to Mira, who will introduce us to the LymphaTouch. Mira.
Okay, sorry. So hi everyone, and thank you for the introduction, Dominic. We are very happy to co-host the webinar together with PhysiQuip, which is our great partner in UK. So I will give you a quick introduction to LymphaTouch medical device, and then we will have the great clinicians telling more about how they have used LymphaTouch in practice. So first, here you can see the device itself. So LymphaTouch is a medical device that creates negative pressure and mechanical vibration to relieve swelling and pain. It also improves the therapy outcomes as part of the treatment sessions. LymphaTouch is a Finnish company, and the product is also made in Finland. And we have more than 30 distributors worldwide selling the product in different countries. It's a CE certified and FDA class 1 exempt device, so it's very, very safe for different patient populations to use. So here you can see the operating principle of LymphaTouch, and I will explain a little bit more in detail. So what LymphaTouch does, it creates mechanical decompression device assisted. So usually in manual interventions, we create positive pressure to the tissue, but with LymphaTouch, we create negative pressure or decompression in very controlled way. So when we are relieving swelling in case of lymphedema, post-operative swelling, or in acute traumas or injuries, we expand the tissue, and that's how we pull the anchor filaments of the lymphatic capillaries, and that's how we open the endothelial holes with the mechanical decompression, and that's how the lymphatic capillaries can absorb the extra fluid around the tissues, and we can activate the lymph further in the lymphatic system. At the same time, we are mobilizing the tissue with negative pressure in a controlled way, and we can expand the myofascial structures and create space for blood circulation and lymph flow. We have these ultrasound videos that you can see some screens below in this slide. So you can go to our website and see more what actually happens inside of the tissue, how we activate lymph nodes and fascial structures, and also how we can work with the scars in ultrasound videos. So LymphaTouch was first used a lot by lymphedema therapists after cancer treatments, and that's where the name also kind of comes from. So whenever it comes with edema management, pain management, or soft tissue mobilization, consultation, LymphaTouch can be used as part of the treatment or the therapy session. So lymphedema, pre and post-operative swelling. In sports, we can treat acute sports injuries such as ankle sprain or contusion traumas. And also in aesthetic medicine, it's common to treat pre and post operative swelling after plastic surgery, for example. As in soft tissue mobilization, we can mobilize fascial structures and fascial restrictions, fibrosis, scar tissue, as we will learn today as well, and many different types of conditions. And also pain, we can treat both acute and chronic pain, neuropathic pain, and by reducing swelling, and we can increase range of motion and reduce pain in many different conditions. So it's a very versatile tool to use in rehabilitation. And here is also, if you're more interested to hear about or read about the LymphaTouch studies, we have our clinical proof book available online. So you can see all the evidence basically in one document. It has the study abstracts of all the studies conducted with LymphaTouch, and also some experience of professionals and patients on how they have experienced LymphaTouch negative pressure treatments. But today we will learn more about how LymphaTouch can be used in case of burns injuries and scar management. So next, Janine, I think the floor is yours. This was just a short introduction, and in the end, if you have any questions related to the technology itself, I'm more than happy to answer those questions.
Okay, good evening, everybody. My name's Janine Evans. I'm an occupational therapist at the Welsh Centre for Burns and Plastic Surgery in Swansea in South Wales. Our burns service covers a population of approximately 10 million people from South and Central Wales and the southwest of England. We have an adult burns intensive care ward, an adult rehabilitation ward. We also see paediatric burns patients on our PEDS ward, and we have an outreach outpatient service at satellite clinics across the region. And we treat around 750 patients per year. My screen's not moving forward. Oh, here we go. Okay, so firstly, a bit of background as to where my interest in LymphaTouch arose. So I think a lot of you here this evening might already know that vacuum massage for scar management was introduced back in the 1970s. And the theory behind it is pretty well documented in the literature. Although it's been widely used in Europe and the US, it hadn't been introduced as a treatment within UK burn services, largely due to the lack of robust evidence base, and also due to the size and the bulkiness and the cost of the equipment traditionally used to perform this treatment technique. However, with the introduction of the Katie Piper Foundation charity in the UK, this became more widely known as a treatment option for burn scars. A few of our patients had been out to a rehabilitation clinic in France where they'd received this treatment and had really positive experiences. And they were really disappointed then when they came back to the UK and found that they weren't able to continue this treatment within NHS services. So I set about investigating our options, as I was really keen to introduce vacuum massage as a treatment within my service. Within Wales, our therapy department is quite space restricted, and also a lot of our outpatient caseload happens in satellite clinics off-site. So I really was looking for something that would give us effective negative pressure massage in equipment that was quite small, portable, cost effective. So good old Google did a little search and popped LymphaTouch, and that appeared to meet all of my criteria. So I got in touch with Dom and we had a little chat about things, and that just confirmed things with me that it was something I was really keen to try. However, as I've said previously, it's really difficult within the NHS to get funding for equipment that doesn't have a really strong, robust evidence base. So I was a little bit concerned as to how we were going to manage to get funding. But we are really fortunate within the UK at the moment to have access to a fantastic charity called Dan's Fund for Burns. And they are really keen to help burn services to fund treatments that aren't traditionally provided by the NHS. So I got in touch with their trustees and we had some conversations about it. I told them about the positive experiences that our patients had had out in France, and they very kindly agreed to fund a unit for us in Swansea for us to try out with our patients, where we also had really positive results. So those were fed back to the Dan's Fund for Burns charity, and they very kindly agreed then to contact other burn services across the UK to see whether they would be interested in introducing the treatment as well. That's one thing that we're really keen to do in the UK. We work very, very closely as a group of therapists, and we're really keen to offer equitable services across the UK. So Dan's Fund, luckily, were really supportive with that. And they agreed to supply devices to 12 services that had expressed an interest, on the agreement that we all evaluated our experiences and our patient experiences in an attempt to start to gather a bit of an evidence base for this treatment. So some of the findings that we had: 88% of patients reported that their scars felt more supple following treatment with LymphaTouch. Some of the comments that we had from patients indicated that their scars felt softer and more mobile after receiving the treatment, sometimes for a period of many days, and that they felt that they could do more. Pain and itch seemed to be relieved in a lot of the patients as well. So all in all, really, really positive results. For those patients that didn't report an improvement, they certainly didn't report any negative effects from using the LymphaTouch. So for the small number of patients that didn't see an improvement, I would say that their scars just stayed about the same after receiving the treatment. And from a clinician perspective, it's so much less labour intensive than the hands-on massage that we would normally do for burns and burn scarring. And that was the biggest thing to come out of it, really. The figures of clinician positive experiences were around about the same as the patient, I would say. Most therapists were reporting that they were happy to be able to use LymphaTouch and that they felt it was effective for the patients, but also it was helpful for us as clinicians. So in conclusion, as I've said previously, without consensus agreement for outcome measures and burn scars, and the intrinsic and extrinsic factors of scarring all contribute to the fact that establishing an evidence base is really, really difficult. Therefore, getting the patient's experiences is really important, I think. It's a really good starting point. In the UK, we don't really have research therapists working in burns. We're all clinicians on the ground. So our ability to carry out formalised research is quite limited. So we thought that this service user evaluation and clinician evaluation gave us a really interesting insight into the effectiveness of this technique for burn scars. And we're all really, really pleased and very grateful for Dan's Fund for Burns for giving us this opportunity to be able to provide this treatment for our patients. However, we are really, really mindful that we do need to think about how we're going to objectively establish a more robust evidence base to demonstrate the efficacy of this treatment. We feel that it makes an improvement. The patients are reporting an improvement, but we all know that we need formal research to back those opinions up. So that's a little bit about our experience over in Swansea. I hope you found that helpful. I'll just pass over to Rachel Wiltshire and Donna over in Chelmsford now for them to share their experiences with you.
Thank you. So as I say, my name's Rachel. I'm lead therapist at St Andrew's Centre at Brookes Hospital in Chelmsford. I'm a physiotherapist by background, and I've got 17 years experience in working with burns and plastic surgery patients. I have with me my colleague Donna King today, who's a specialist physiotherapy associate practitioner, Band 4, and she does a lot of the treatments here at our service using LymphaTouch. So I was initially introduced to LymphaTouch through the Burns Therapy Special Interest Group, which is part of the British Burns Association, and Janine demonstrated it to us as a group of therapists. I then met Dom at the British Burns Association conference to have a look at the device for myself, and was made aware of the very kind opportunity that Dan's Fund provided us to resource funding for the equipment. It was still fairly challenging to get the device purchased. It had to be purchased internally through our NHS organisation and then cross-charged for the refund to Dan's Fund. But we were very pleased to take receipt of the LymphaTouch device. And we then needed to look at our standard operating procedure and conduct risk assessments and competency packs for our clinicians that would be using it. We worked with our colleagues within London and South East Burn Network, and we were very grateful for the assistance that Chelsea and Westminster burn therapists gave us. They also had a lot of experience previously of using vacuum massage for scar management with a different device, but a lot of their knowledge and work that they had done was very informative in us setting up our service. And we began clinical use in January 2019, so almost 2 years experience now of using the LymphaTouch. We are a centre for burn injuries, which means we take the most severe burn injuries for both adults and children for London and the South East. And similar to Janine's service in Swansea, we service a population of approximately 10 million. We have used LymphaTouch on children as young as 7. We found this was the youngest that we could really use it effectively on, because the child had to be able to understand what we were doing and sit still long enough for the treatment. We've used it on a variety of size and severity of injuries, some significant injuries with large body surface areas through to some smaller areas that have been grafted as well. We tend to use it on areas that are tight or tethered, where there's restricted range of movement, where the scar's problematic or hypertrophic. Can be used on grafted areas, on free flaps, on donor sites after reconstruction from burns surgery. And we have used it in our plastic surgery departments and hand therapy departments very successfully as well. One of the benefits of this treatment is that it can be delivered by Band 4 and above as part of their therapy package. It doesn't have to be a qualified member of staff that is delivering the LymphaTouch treatment. So our patient selection really is key, and it's part of our holistic assessment that we would do for all of our scar management patients. Ideally, we treat tight scarring, contracted areas, tethered scars, where it might cross a joint and restrict range of movement. But it does require patient commitment. One-off treatments we don't find to be effective, so we wouldn't offer it as a one-off treatment. It has to be a patient that's willing to engage and commit to coming back for regular therapy. Our treatment delivery is mainly limited just by capacity issues. We do try and treat patients at least once a week. More potentially would be beneficial, but it does depend on our availability of appointments. With such vast numbers of patients that would benefit from it, we have to be selective in how much we offer each one. We find that we can treat up to 10% body surface area per session, as it can be quite time consuming to do any more than that. We can deliver the treatment in a normal therapy department in gym cubicles, but because of the portable nature of the LymphaTouch, we can take it out onto the wards, out to people's homes or to satellite clinics, which is a real advantage of the device, potentially over other larger negative pressure devices. The different size treatment heads are really useful in treating different areas, particularly the smaller treatment heads when you're trying to treat intricate areas such as around the ears, around the nose, around the eye, or even a bony prominence like the ankle. One of the key points in treatment is to choose the right size treatment head so that you get a good accurate seal. And if you have areas where there's big contour defects, particularly with sort of polytrauma plastic surgery patients, you need to make sure that the treatment head is a sufficient size that you will get contact with the skin and generate that negative pressure. Patient outcomes, as Janine has said, is a challenge for all of us with any scar management. We have tried to gather as much information as we can on outcomes of using the LymphaTouch treatment. We're using patient-reported outcomes and the POSAS, which is a patient and observer scar assessment score. We're taking photographs before treatment, during treatment and afterwards, and measuring range of movement. So some of my colleagues in hand therapy have found significant improvements in range of movement with tethered extensor tendons, for example. I've got a couple of quotes from patients which mirror and echo, as Janine has just said. First patient felt that when combined with resistive exercises, I feel the LymphaTouch increases my range of movement for the rest of the day. I really feel a difference after my treatment. My scars feel much better and movement's much easier. And from my youngest patient, one of the youngest ones, age 8, I like being able to do it myself. So we can give patients ownership of their treatment. Even patients with very hypersensitive scars or that are very reluctant to have their scars touched actually find by being able to hold the device themselves gives them some control and helps them start to be able to progress more with their other treatments as well. So in summary, LymphaTouch is a useful adjunct in the management of our scars for burns and plastic surgery patients. It's been shown to be beneficial within our service, and we're using it more in different areas of our caseload the more experience we get with it. It supplements conventional therapy and is part of our holistic treatment of that patient. But I'd absolutely concur with Janine that further research on its effectiveness in scar management would be really helpful to build the evidence base to support its use. That's the end of my presentation. Thank you.
Wonderful. Thank you all very much for sharing your information. That's really interesting. So we're going to now start on the question and answer section. So anybody is on the call, please submit your question and answers. Question and answers. Please submit your questions and we will get them answered. Any questions are good questions, so please don't be shy. Pop it in there. We do have some pre-submitted ones to get us going. But one question is coming straight away. Dee, who's one of our regular webinar listeners. Hi, Dee. I'm gonna open up this to Donna because I know you're very hands-on and you're working a lot with the device. How soon can you work on the scar tissue?
Normally we work on it from about 6 months on. However, there's no specific time limit. It's more assessing the scar individually, how quickly they healed, obviously assessing the scar, making sure it's not too vascular, and making your own assessment. But generally we start to look at patients at about 6 months when the scar is settled and we can begin treatment with them.
And does it, I mean, to add on to that as well, does it vary on, obviously you mentioned about the size of different types of scar, does type of burn injury, so it's steam burn, chemical burn, heat burn, is there any difference in the way you'd approach them?
No, the mechanism of burn doesn't seem to matter at all. It more depends on whether the burn has actually caused a scar that we work on. But we also work on donor sites as well. So not always the injury that's actually been caused by the burn, but the injury that we've given them as such. So it's working on both.
Oh, perfect. And forgive me if I've pronounced this wrong, this name wrong. It's Asa has asked, how old of a scar can you treat? So I suppose what's the oldest scar you've treated so far, and have you had a good result from it?
The oldest scar so far has only been, I'd say, about 2.5 years old, only because we haven't had the capacity to look at older scars yet. obviously we would love to work with our patients that are a lot further down the line. However, we have to work with our priority patients at the moment. But that's not to say that they wouldn't work effectively with older scars. But at the moment, it's worked well with scars up to 2 to 3 years we've been working on, and they've showed an effective result so far. So hopefully older scars as well.
Yeah, and I think with again with on this, and I'll open this one to Janine in a second as well. But Donna, from your perspective, Claire McGrory, who I know is a UK based, she's asking, how many treatment sessions do you tend to do per patient? Obviously, I know COVID's probably thrown that out the window, but ideally, like how many sessions have you been doing per patient?
Each patient is assessed initially, and depending on the size of the scar that we're going to be working on, we normally stick to around 6 sessions per patient. So at the moment, they're spread out over a 6-week period. After that 6 weeks, we then reassess, see improvements that have been made in what areas, and look at whether they should have another set of 6 sessions to continue with, and again evaluate after.
Perfect. And Janine, just from your perspective, because I know you introduced the LymphaTouch, you're the first person that I spoke to about it, and then offered it out as well. Is there sort of expand on that? How long do you treat the area, or how long do you treat? Did you have like an ideal as to what you were working towards, or is it again similar to what Donna said, you're just working on a patient by patient basis?
Yeah, it is completely down to the individual patient. We're very similar to the Chelmsford service. We offer 5 to 6 treatment sessions per patient. But, you know, some patients will have less, some patients will have more. So there's no set amount. And again, this is partly because there isn't that robust evidence base, you know, there's no guidance really at the moment as to what frequencies you should be using, how long the treatment session should be in duration, the frequency of the treatment sessions, or even how many in total you should do. So we're just going case by case. It's building up on our own experiences, as Rachel said earlier. And I think coming together as users across the UK certainly will be really helpful in helping to establish some sort of baseline, I would say, although the nature of burns and scars means that everything we do will always be on an individual patient case basis.
Yeah. All right, fab. I mean, so I'm just while I'm thinking this, there's absolutely tons of questions coming in, so really appreciate everybody engaging in this. So I just want to make sure if we don't get around to your question, we will get them answered afterwards. So don't be disappointed if we don't get around to them. I'm just trying to pick some of the ones that got biggest impact on here. I just kind of want to touch on the research side of things, because obviously, you know, I think there's, Janine, you mentioned there's 12 systems originally. There's now 16 units in the UK, so we've had another 4 that have jumped on board. A couple of them on tonight. Michelle O'Donnell from Ireland has joined us. So hi, Michelle. She's asking that they're lucky enough to have a cutometer, if you know what that is. I'm not entirely versed in that. And they're looking to include this as an outcome measure. Are there any other, so Janine, from your perspective at Swansea, and I'll ask the same to Rachel in a second, are there any other units that you're using the cutometer with the LymphaTouch as well?
We don't have one. So the short answer to that is no at Swansea. I think Birmingham has a cutometer up there. I'm not sure whether they've been using it with the LymphaTouch. I know Birmingham Children's had a unit, I think, at one point, did they? Oh no, maybe adults. I'm not entirely sure, to be honest. But yeah, it's a tricky one, isn't it? Because there's no consensus agreement as to which outcome measures we should be using with patients for any scar management interventions. But I do think it's important that if we are going to be looking at outcomes, we need to agree as a group which assessment tools we're going to be using. Cutometer would be the obvious choice because it's going to measure your skin elasticity, which is one of the things we would hope to see improving through using LymphaTouch. But the availability of a cutometer within services is really restricted within the UK. So obviously that limits the number of patients that you can use that assessment tool with then.
I mean, on that, so one of the pre-submitted questions, I know there's a couple of questions coming on here. So Rachel, from the service at Chelmsford, what are the objective measures that you've trying to be implementing of monitoring how LymphaTouch has been doing?
So I agree, a cutometer would be ideal because it's pliability really that's the main factor with the LymphaTouch we're trying to improve. With improving the flexibility of the scar, essentially, we have the side effect of increasing range of movement. So that's often a really good outcome for us and significant for the patient's function as well. Quality of life and functional assessments are a part of it if that's what we're treating. It's trying to have an outcome measure that's really tailored to the treatment outcome we're aiming for. We are currently putting a bid in for a cutometer here at St Andrews, so if we are successful in that bid, then that would be an ideal solution for it. But as I said in my presentation, we're really relying on patient outcomes, POSAS, range of movement, photography, which it helps to build the picture, but there's not one absolute outcome measure that's capturing the effectiveness.
I suppose that's the challenging aspect with scars, isn't it, as well, as like Donna was talking about earlier, is that they're all so different or can be treated so differently, and trying to get that standardized objective measure is very different and very difficult to get. But it's good to see though that you've been getting the patients that have been relatively consistent in terms of their feedback, so that's obviously a step in the right direction. And I mean, on this, so Janine, I'm gonna pose this one to you. So Polly Brookes is on, and a massive shout out to Polly. For those who don't know her, she's the founder of Dance Fund for Burns, who has supported us massively. It's a fantastic charity, and Polly's amazing with what she does and her story in life and things. So Polly's just asked, in terms of gathering more evidence, what do you feel we can do to help? Is this something that they could get CAR or UWE involved? If you know those acronyms, I'm not familiar with those acronyms.
The Centre for Appearance Research. Yeah, I mean, I think what we could do with forming is a LymphaTouch user group, possibly. Because as you said, there are 16 services across the UK using LymphaTouch now. And as a group of burns therapists, our specialist interest group is very, very active. So I think that would be a really useful way forward, is to meet as a group, agree on the most important outcomes that we need to be measuring. And I would expect that to be a range of different outcome measures. And then possibly, yes, Polly, have those discussions with you guys at Dance Fund for Burns and see where we can take it.
Perfect. Rachel, anything to add from that perspective?
No, I think Janine covered it. Yeah.
Cool. So I'm just going to bring in Mira. So from the LymphaTouch, the technical aspect. So we've had a question from Fatima Saley, who says, thank you very much for the presentation. Does LymphaTouch work on a similar principle to traditional dry cupping? And if so, what's the main difference? And what's the main difference? The second part of the question is it painful? Which I'll offer out to Donna in a second. But yeah, for Mira, for you, what's the main difference between LymphaTouch and traditional dry cupping?
That's a great question, and it's also a question that I faced many times because people really like to compare LymphaTouch to cupping. It might seem a little bit same, but it's actually different. So the operating principle of both is negative pressure, but with LymphaTouch, first of all, it's a medical device, and you can adjust the negative pressure very precisely. When you are doing cupping therapy, you have no idea about the negative pressure inside of the cup, and you can cause some damage on the tissue. But with LymphaTouch, we can adjust the negative pressure and increase the amount gradually according to the patient's sensations and how the tissue reacts. And also we can add negative pressure with the dynamic way or with the continuous negative pressure. And we can also apply mechanical vibration in addition. So it's basically completely different, even though in the first side it might seem a little bit the same, but it's a very common question, so I'm happy that it came out.
I just the pressures you mentioned about being able to control the pressures. You've got between, if I remember right, it's 20 to 250 millimeters mercury of pressure. So Donna, just coming across to you from that, so being able, you have that full pressure range there. Is the treatment painful for the patient?
Generally, no, it's not painful at all. We tend to start at a smaller level and build up as the patient can tolerate. They can also have some areas of hypersensitivity, so we obviously have to adjust to those sensitive areas. But If they do feel some soreness afterwards, which sometimes does happen because of obviously the nature of the product, however, you know, a few days it's normally settled and then reassess the numbers again, but generally no, not too much.
And just to add on to that with Anastasia, who's asked as well, so welcome Anastasia, thanks for the question. Which mode are you using for the treatment of burns? I think predominantly, I think it's you were using the intermittent pulse, you're using continuous, a mixture. How are you?
Mixture.
Right, okay.
Complete mixture. We tend to use the vibrations more with the children because they prefer that and it's more tolerable to them. But in the adults, it all depends on the scar, the location, the flexibility, the restrictions, all things like that on what we're using and what seems to have the best effect with them. But no, we like trying them all out.
And then just again, from the application perspective, Amberly Prince is asking, how long does a treatment session last for? She's basically saying if you're focusing on a 10% surface area, typically how long is your session lasting for with LymphaTouch?
We do about 30-minute sessions.
Okay.
But again, if you've got a very large area, you're only going to be focusing on one area over, say, the 6 weeks period. If you have a very small area, then the sessions can be smaller and you could probably do them more often. So.
Perfect. And Mira, I'm coming back to you just from a technical aspect. There's been another question about contraindications from Julie Reed. Obviously, don't recite them all off the top of your head, but sort of what the contraindications for LymphaTouch.
The contraindications are exactly the same as they are for any other type of manual treatment. So basically acute infection, acute thrombosis, don't use the device. It's very safe for many patient populations. And if you would do a manual treatment, you can also apply negative pressure, start with lower level and increase gradually.
I just can add to that I would say that where you have fragile scarring, but you're still at risk of tightening and tethering, you can use the LymphaTouch quite successfully on the adjacent skin, the healthy skin, and still influence the lines of tension that are forming in the area that's fragile. So although you would avoid treatment on that specific area, you could still use the device safely.
Cool. I mean, on that as well, because I know obviously with burns you get a lot of graft sites and things like that. Are there any kind of, like, again to you, Rachel, are there any main things? I know I've dealt with a couple of them where they've had a graft site that's had the blood supply put in. Is there any kind of like time frame that you would want to avoid using that?
Yeah, I mean, as Mira said, it's the same rules as you'd follow for any manual treatment. So you'd want to make sure that they're fully healed. If it's a highly vascular scar and you risk increasing the vascularity of it by doing a manual technique, you know, that could be detrimental, so you might want to avoid that. If it's still very hypersensitive, then we probably would go with a lower pressure initially and possibly start with some vibration as well. Treatment duration could be shorter, so we might do a trial, like a 5-minute treatment, and then build up to the longer sessions of half an hour in due course. So the beauty of the treatment really is that it's very adaptable to treat what you find in front of you. There isn't a rule book of you must do this treatment at this pressure. It's quite intuitive to once you're experienced in knowing the scar treatment, you can modify and adjust the treatment accordingly quite effectively.
I mean, one of the things, I mean, I'm obviously teaching people when they're using LymphaTouch is with the contraindications on that point, would you say it's fair to say if you don't put your hands on it, you don't put LymphaTouch on?
Yeah.
That's kind of my main thing. And then would you be fair to say, and I think Donna as well, from your perspective using it as well, a lot of the techniques and everything that you know with your hands and everything that you've learned with how to use hands in manual techniques, would you say that it's transferable to LymphaTouch and you can use it in that kind of way, so that the learning curve is quite a short period of time? Would you say that's fair?
Absolutely. You know, I think they complement each other as well, the two treatments, and knowing your skills in manual technique, you can put that into practice in the LymphaTouch by adjusting the settings to the type of manual technique that you would do specifically. So yeah, I think they complement each other well.
I'm glad you mentioned that, actually, because it's I think we mentioned, I can't remember whose presentation it was on now, about the saving of the hands. Was that yours, Rachel? Yeah. Obviously there's stacks of evidence about manual therapy, the rate of arthritis in the hands and the fingers and things. But it's great you said they're a compliment, Donna, because I'm a massive advocate of still hands-on therapy is really, really important, and getting that sense of feel and sense of touch. I just wanted to go on sort of Nona's question who's just come in, and she's asked, so from your perspective, Donna, with your experience, how long does the effect last after you've done the treatment? And I think probably more to say, let's take it from after one session, how long does the session last? And then after a course of treatment, how long have you seen it lasting?
Well, generally we've been going by patient feedback on this more than anything. So if we've been seeing the patient weekly, they'll report how long they've been benefiting from it after the session. They say it lasts normally within the first couple of days, particularly the first day. They've got improved range of movement and much more flexibility in their scarring. Also a bit less pain, they often report. Over the course of this 6-week period, generally we found that there's been quite a large improvement in pain and in range of movement, combined with other techniques as well. The great thing is it can be combined with other invasive surgeries once the heel has settled as well. So we can continue using the LymphaTouch after such things as laser and other skin pin treatments.
So I was going to nicely tied into the next question there, Donna, and you've probably not even seen that. So one of the questions is, what other treatments are you using alongside LymphaTouch? And also, I've just lost where this question is. Here we go, from Alexandra Bayliss. Are there any specific scar management tasks aside of the normal ones that you're advocating to do in between treatment sessions? So two-part. What are you using LymphaTouch alongside with, and then what are you advocating between sessions?
To me?
Yes, sorry, Donna, yeah, to you.
Alongside, we're using normal manual techniques, the continued moisturizations, regular creaming throughout the day, stretches, your exercises, more invasive treatments as well, like derma rolling, your lasers, your reconstruction surgery. Obviously, once the scar is settled, then they can be worked on again, but we're continuing to use it with all of our standard scar treatment techniques really well. Great,
thank you. And Janine, do you, from your experience of how you've been using it down in Swansea, so Jocelyn Davies is asking, do you have any recommendations for the use on scars that are very firm with increased relief? So it's difficult to obtain pressure. Do you have any recommendations for use on those firm scars?
You just need to make sure that you're using the right treatment head, really. Sometimes if the relief, that can affect your seal ultimately. So you might need to play around with the treatment heads a little bit. But generally it's that type of scar that we find it helpful for, the really raised, tight, uncomfortable ones. It's just sometimes, depending on the location, it can just be quite tricky to get the seal right, ultimately.
Yeah. And Rachel, sorry, I'm going to open this to all of you as well. Is Gerd's asking, have you any opinions on, sorry, let me start that one again. Do you have any opinion about if the scar is matured or if it's in the process of maturing? And I presume that's when you're going to use LymphaTouch.
Yeah, as I said earlier, in a very vascular reactive scar, you are going to be stimulating blood flow to that scar and can potentially make it have a detrimental effect by doing it. So I would be quite cautious on a very freshly healed scar that I say is capillary refill, very brisk. On mature scars, as we discussed earlier, I personally think it would still be beneficial on scars after 3 years. We just have capacity issues. We have to prioritise who we're treating, and our major burns tend to be in therapy regularly up until 2 or 3 years post-injury. So that's the sort of time frame that we're working to with the majority of our patients. But that's not to say that I think it wouldn't be worth trying on somebody that's got tethered scarring that's older than that.
Janine, anything to add?
No, I'd agree with what Rachel said there. our patients tend to be with us for about 2 to 2.5 years probably, so I haven't actually had experience of using it with scars older than that. But as Rachel said, you know, there is a high likelihood that it would be beneficial. It's just getting those patients through our services, really.
Perfect. And Donna, anything from yourself to add on those?
No, just literally what Rachel said. It's a capacity issue more than anything, on whether we can explore older burns.
Perfect. I know. I'm coming from my experience. Actually, Mira, I don't know if you've got any experience with any mature scars. I think one of the old. It's not a burn scar, I will admit. It was an orthopedic scar that was 14 years old and still managed to get a release out of that, an increasing range of movement. I know it's slightly different in terms of obviously the extent of the scarring. Mira, have you got any experience or know of anything that's happened across Europe where people have been treating older scars?
I don't have that much experience. I haven't heard, because UK is our pioneering country to use it, especially for burns. In China, and I think in Sweden as well, and in some other countries in Europe and Asia, and I think also in USA, there are some locations that are also using the device for burns management. But we have more experience and information and data on the scar treatments, like surgical scars, and there they have had pretty good results also for mature and older scars, like 5 years and older. So just give it a shot. There's, as mentioned already quite many times, we need more research on this side. But again, scars are so individual, even though many other conditions are as well, but scars especially are so individual, and they are located everywhere and always different. So the research side is also complicated in that sense, but we really need more research on that.
Cool. And just on that as well, predominantly talking about burns, Fatima's also asked, is it limited to scarring for burns, or have we got experience with it being used elsewhere, and where can you sort of say it's being used elsewhere on scars?
So we have, for example, it has been used for orthopedic patients, such as knee replacement, hip replacement, elbow replacements, also in cancer patients when they have had some breast surgeries, and basically everywhere in the body where there have been any surgical procedures, they have used LymphaTouch. Also, like very soon post-operatively, never on top of the fresh scar or open wound, don't go with LymphaTouch, but we can also activate or support the healing process by activating the lymphatics around the fresh scar. But there is more information in other scars as well.
Right.
Not in our breast service.
I was just going to get to that, Rach. I was just going to say, because I mean, you've got it in your breast service, haven't you?
Yeah, so we're using it for post mastectomy and reconstruction, cording, fat necrosis, post radiotherapy. We're using it really effectively.
And I think to add to that as well, Fatima, and for everybody else as well, is that, like Mira mentioned at the very start, when people, LymphaTouch was essentially born in lymphedema. Over the past sort of 3 to 4 years in the UK, really, the people that have been, or the services that have been adding LymphaTouch to their services have actually been buying it for scarring, head and neck scarring, followed radiotherapy, breast scarring, groin scarring, because the MLD techniques and the bandaging and the compression has been enough to manage the edemas. The scarring was their biggest problem. So it was quite ironic, really, how it was very, very effective for drainage, but people were using it for scars. I just want to kind of just change a little bit with the so Janine, obviously we're talking a lot about scars, but we know LymphaTouch is very good for wound healing. Is there any kind of desire or any kind of wanting to look at how it can help potentially with delayed wound healing and anything like that, and looking at actually edema management as well in burns?
Yeah, we've not considered it formally, to be honest, and especially this year now, unfortunately, our outpatient services are all a little bit restricted because of what. So yeah, I mean, at some point in the future, definitely. But from my perspective as a therapist, I'm really more interested in looking at establishing the evidence base for scar management in the first instance. although I'm sure that some of my colleagues would be very interested in the wound healing applications of it.
Perfect. And Rachel, anything to add on, sort of, if you've actually looked at it from a edema management perspective?
For edema management, we've been using it for wound management. We've not looked at yet, no.
Okay, well, there you go. Food for thought. I know it's used in wound management as well, so that's food for thought on that one. Obviously, we mentioned, you know what, the situation we're in at the moment. So Jessica Smith is just asked, Rachel, how has the use of LymphaTouch changed since COVID?
Well, I think all services had a period of time where we were unable to do any face-to-face contacts for outpatients, which obviously meant that the service had to be completely suspended. Since we've been able to see patients face-to-face, it's been on a priority need. We've had to triage our patients to those that absolutely have to come in. Essentially, those patients that are receiving LymphaTouch in our service are patients that need to be seen face-to-face. They have got significant problematic scarring that's limiting their function. They are a high priority. So since June in our service, we have been able to restart our outpatient contacts, and that has included our LymphaTouch treatment. Obviously, as the situation is at the moment, we're not sure what the next changes will be, going into perhaps another more restrictive way of delivering healthcare again.
It's a funny time at the moment, isn't it? So, Donna, come to you in terms of the experience. So, have you seen any? So we've got basically two people, Samantha Bennett and Gerd, have asked this question. Have you seen any adverse effects or complications following a LymphaTouch treatment?
Generally, no. Some areas have been more problematic, I'd say, due to, say, excess hair around the scarring. Obviously, if you're using high suction, it's causing the patient some pain. So we've had to adapt there. And again, some soreness in children, but generally, no complications following treatments at all. It's so closely monitored, I think, at the time, and patient feedback is so important that it's resulted in no complications. Touch wood. That's it.
Yeah, touch wood. I think that's what it comes down to, isn't it? It's just the right patient. I know the only thing that may be deemed as adverse effects is patient. I think you mentioned it a little bit earlier. Is patients can feel a little bit sore for a couple of days. Do you put that down to the fact that you just moved the scar in a way that it's not used to?
Absolutely, and it's the same as you would with a manual technique. They're going to have some soreness after, because you're causing pressure one way or another. So they're generally used to a bit of soreness after, so it doesn't seem to affect them too much.
Oh, good. Have you treated any facial scars at the moment, Donna?
Yeah, treated facials. It helped when we were able to get the smallest suction cup greatly, because you could get around the really small intricate areas around the nostrils, above the eyebrow and around the lip. Obviously you run it at much lower settings, but no, it's been really effective, because you can get a full clear suction on those areas much better than you would with the other.
And just on that, I've seen that's Alexandra Bayliss is just asking, do you have any set settings for facial scars, or does it depend on the patient's tolerance?
No, it does depend on the patient's tolerance. However, you do need to be careful, because obviously it's much more sensitive on the face, and the skin can be more fragile. You also need to be able to get a clear enough suction. So the settings are lower, but there's no set lowering. It's patient specific. You just assess as you can with each patient.
Cool. And obviously you've treated a lot of patients now with this. So Dee Stringer, who I know is a lymphedema specialist, she does a lot of scar tissue release as well. Do you find there is an emotional release as well as a physical one whilst doing the treatment? Donna?
Yeah. Absolutely, yeah. The patients really do emotionally feel that their scars are changing and that they're getting improvement from it. So the feedback that we receive from them is really good. They feel that they're seeing an improvement each session, be it small or they're getting a little bit less pain than they were previously, even if the scar isn't drastically changing. So emotionally, great improvement in mood from patients.
I'm just going to add on to that actually some patients, it can potentially be harder to stop their treatment because they do enjoy it and come to the end of 6 sessions and they would prefer to have more.
Yeah.
Are you seeing that the same in Wales as well, Janine?
Yeah, definitely. I think the patients really benefit psychologically from feeling like they're having something done. And also it gives you a really good opportunity to build up more rapport with your patients as well. Obviously a 30-minute treatment session is a long time to keep a conversation going, so you can actually find out a lot about how their scarring is affecting them on a day-to-day basis, how their well-being is and their mood. There are so many other things that you can assess whilst you're carrying out LymphaTouch treatment. It's really, really helpful in many respects, I would say.
Perfect. And Rachel, I want to come to you actually, because obviously just tying into that emotional aspect is, you mentioned in your presentation you've had patients actually treat themselves with it, which I know is something that I kind of came across about a year ago now. How impactful have you found that, and how do you even get the patient to treat themselves? Like, explain how that kind of came about.
I think it's really useful in patients that are highly anxious about having their scars touched. They can be very traumatized after having repeated dressing changes and procedures done to them throughout the course of their burns treatment. And so initially, to have something that they are able to control just by holding the treatment head. Obviously we're setting the machine and you know, assessing what treatment they actually need with it, but just letting them hold it with us or hold it themselves on their skin, trying it somewhere that's an unaffected body part to start with, so they know what it feels like before they have the treatment on the scar area. Once they've had the introduction, often they're quite happy for us to do the treatment to them. But if that's an area that they're very reluctant to touch themselves or to have anybody touch initially because it's been so painful or it's so sensitive, it really helps to break down those barriers and open up the treatment options.
Oh, great. Because I know something that I came across when a patient didn't want, a breast patient didn't want me to treat. Absolutely understandable. It was actually really quite empowering for her to treat herself, and I suppose that's a sort of nice little added value. And I was looking at, we're running out of time here, so Rachel, I'm just going to ask you one question from Ali Hunter, who is, I believe, if I remember right, Belfast. So Ali is asking, if there has been an internal fixation, are there any contraindications for the use of LymphaTouch on the vibration mode? Have you got any thoughts on that? I'll ask this to Mira in a second as well.
Yeah, I've not actually had anybody that's applicable to. We have had patients that have had sort of plastic trauma lower limb with orthopedic involvement as well, but I haven't had anybody that's had an external fixation or even a K-wire actually. Have you, Janine?
No, same. I haven't had experience of that, I'm afraid.
I know with, just to add on to it, because I think there was somebody asking as well, was about metalwork or K-wires in the localized area, is you can treat around it. I've treated fixations in the ankle from fractured ankles before, which I know it's slightly different area. But when it was well healed, when the surgery site was well healed, they were very stuck around the ankle in terms of flexion extension, particularly. Sorry, flexion, plantar flexion, dorsiflexion. So I was able to treat it on that area. But obviously, any external stuff you go around, if you're not sure, I think, would you all agree, if you're not sure, don't treat on it. Mira, would you say?
Exactly the same thing. So there have been cases in orthopedics where they have used LymphaTouch also for with persons who have had the external fixations, but of course around that area and with very low negative pressure values, because we don't want to move those fixators. So yeah, that's a good thing. But it's I want to add that the mechanical vibration is again mechanical, so it doesn't require any kind of electrical stimulation or anything like that. So in that sense, it's safe to use, but I would start with very low negative pressure in the value in the beginning.
Yeah, I think that's what the mechanical vibration is. We know it's actually another area that I work in with shockwave, which is high energy mechanical input. there's a lot of evidence with actually how it's stimulating bone growth as well. So the high, if you've got anything that's like around delayed unions and things, mechanical vibration actually might be quite useful in terms of stimulating bone growth. However, we talked about evidence before, there's limited evidence on that. However, I know there is evidence in terms of for high energy focus shockwave for bone growth. So that might be an area of interest. But guys, we are literally out of time. We still have a few questions to go through, but what we'll do, guys, that have answered, you've asked the questions, is we will get those answered for you afterwards. So we've got those all recorded. We know who sent them in. So we will follow up after the session and get those answered for you. But we're out to wrap it up. So I'd like to say a massive thank you to all of the speakers that have joined us this evening and answering all the questions and providing your presentations. And also thank you for all the participants that have joined us this evening. And also thank you very, very much for sending all your questions in. I hope we've been able to answer them appropriately for you. Following this session, you'll be sent out a Survey Monkey. So we'd really appreciate if you could just take 2 minutes just to send your feedback on what you think about the session. And any obviously questions or any other subjects that you'd like to see in the future, we'll look to try and facilitate that for you. You'll also be sent the link to the recording as well for this session. So if there's anything that you've missed, you can watch it back, take your notes, and also share it with any of your colleagues. In terms of what we've got upcoming, so we do have a couple of upcoming webinars. Thursday, 22nd of October. If you want to find out more about LymphaTouch, we're running a specific product meeting where you can find out more from the technical aspects of the device and a little bit more about the application. And that's going to be in the middle of the day during lunchtime. And then on the 9th of November, we've got a really interesting webinar. It's going to talk about periorbital edemas, the swelling around the eyes, and how LymphaTouch has been helping to treat that and helping patients avoid invasive surgery for that particular condition. You'll be sent that in the email after as well. Any further questions, contact us at PhysiQuip, info@physiquip.com. Otherwise, again, thank you all for attending and your participation, and have a wonderful evening. Take care all.